Thank you, Speaker. My question is to the Minister for Health. How is the Albanese Labor government's cheaper medicines policy delivering more choice, lower costs and better health care for women across Australia?
A call to the Minister for Health, Ageing, Minister for Disability and the NDIS.
Thank you, Speaker, and thank you to the member for Newcastle. On more than one occasion she reminded me that you can't be serious about strengthening Medicare if you're not serious about supporting women's health, because women consume about 60% of health services in this country, often not because they're sick, but because they're women looking after their reproductive health and, by extension, supporting the reproductive decisions the broader family makes, or because they're going through menopause or perimenopause. And a number of Senate inquiries in the last term of parliament, Mr Speaker, lifted the lid on the years of neglect of supporting women in those areas of our healthcare system. There had not been a new oral contraceptive pill added to the PBS for more than 30 years. Not a new endometriosis medicine added to the PBS for more than 30 years, and not a new menopause hormone treatment added for more than 20 years. Not because they hadn't come to market, they just hadn't been added to the PBS, forcing women to pay top dollar for those new cutting-edge medicines. Well, Mr Speaker, we changed that. In the last several months, we've added 3 new contraceptive pills, 3 new menopause hormone treatments and 2 new endometriosis medicines onto the PBS, saving women millions and millions of dollars that, frankly, they shouldn't have been having to shell out in the first place. The endometriosis medicine, for example, Ryeco, was costing women $3,000 a year, that cutting-edge, highly effective treatment for endometriosis. Now they pay barely 1/10 of that cost, Mr Speaker. But we are determined to do more because, to the Prime Minister's comments, the Australian people said yes to even cheaper medicines. And so, from the 1st of January, the maximum cost of a script will be slashed to $25, the same rate it was all the way back in 2004, Mr Speaker. This morning, the Prime Minister, Assistant Minister McBride and I met a young woman, Cara, who already in her early years is grappling with a number of chronic health conditions. She's on a number of medicines, Mr Speaker, and they really do put a dent in her household budget. One of those medicines is Slinda, a highly effective contraceptive pill that tens of thousands of women had been using for months and months and years, paying top dollar, that we added to the PBS earlier this year. Before that, women were paying $320 a year for that cutting-edge medicine. From the 1st of January, they'll pay just $75, a 3/4 cut in the price of that medicine. The reason why we are going so hard, Mr Speaker, on making medicines even cheaper is not just for the hip pocket. I mean, it's a benefit to cost of living, but also because it is so important for health. Trying to support Australians, make sure that they can fill every single script that their doctor says is important to keep them healthy.